To Dr. Robert Redfield, the former CDC director, what he makes of this. Doctor, good to have you. Are you worried about this monkeypox?
No, Neil, I'm not overly concerned. I think the big concern is to try to understand what the reservoir is for the expanded infection. This virus is pretty concentrated right now in the Congo region, which is one of the major strains, and in the West Africa. And most of the cases that we see outside are really imported cases secondary to animals that have been imported from, say, West Africa into the pet market, and then they cause secondary infection. So I think the big concern is really what's the reservoir here. Clearly, there's concentrated cases now among men who have sex with men, and try to understand what the epidemiology of this new expanded outbreak across the world right now is probably the key question. But no, overall, I think this is going to be a highly contained pathogen, limited impact on our public health system across the nation.
I hope you're right about that, Doctor. You know, Deborah Birx has been on this nationwide book tour, and she has been warning of a big summer COVID surge. Again, a surge from these levels, certainly nothing like the levels we had at the height of COVID. Where are you on this? Are you worried about this? Are we looking at a surge as we speak? What?
You know, Neil, I think we have to be circumspect here. I think it's one thing I've learned about COVID is to be careful to be too definitive in your predictions. You know, I'm extremely concerned about a major surge October, November, December, January, and I think it really could have significant consequences, particularly combined with a major surge in flu. Clearly, right now, there is a major uptick in infection across the nation. I know Ambassador Birx is particularly concerned. She tracks this data very closely. I talked to her yesterday about really a significant surge coming in the South, similar to what we had last year. I don't think it's going to reach the levels that we had before, largely driven by the fact that Omicron was such a successful pathogen and it infected so many people that our immunity levels are probably higher than we had when we had the surge last year, and our vaccination levels are higher. But I'm not going to, go out and predict. I am concerned that we are seeing a significant uptick in infections. I do think we have to caution ourselves to learn from the past and not knee-jerk our response into the idea of closing schools and closing way of life. We got to really learn to live with this pathogen on its terms. I would encourage the American public to keep their vaccination status up, particularly those of us over 50 and those of us that are vulnerable. It's clear that the vaccines are highly effective, but they have a limited durability, and after, say, 4 months, 5 months, you really need to fill up the tank again, if you will, and get revaccinated. So I think we have to be cautious. I have a lot of respect for Ambassador Birx. She's tracking the data carefully. I don't think we're going to have a surge, though, that's comparable to what we saw, say, a year ago. But we got to continue to follow this carefully.
Doctor, thank you very, very much.